Internal carotid artery arises at the bifurcation of the common carotid into the external carotid and internal carotid arteries. The internal carotid artery has 7 segments. They are named C1 through C7. C1 is the cervical segment, C2 is the petrous segment, C3 is the lateral segment, C4 is the cavernous segment, C5 is the clinoidal segment, C6 is the ophthalmic segment, and C7 is the communicating segment of the internal carotid artery. Let's see the course of the cavernous segment of the internal carotid artery. It enters the cavernous sinus through the carotid canal. It has 3 subsegments that are connected by 2 genu. It enters the cavernous sinus as a short vertical ascending segment. It continues as a posterior genu, which is followed by a longer horizontal segment that terminates as the anterior genu. The anterior genu continues as anterior vertical ascending segment. From its entry into the cavernous sinus inferiorly to its exit from the cavernous sinus, the internal carotid artery courses lateral to medial in the coronal plane. That makes the posterior genu lateral to the anterior genu. Within the cavernous sinus, the internal carotid artery is related to the sympathetic plexus that terminate in the eye, and the ipsilateral abducent nerve is located infralateral to the internal carotid artery. Within the cavernous sinus, the internal carotid artery gives rise to 2 major branches. They are the meningohypophyseal trunk and infralateral trunk. The meningohypophyseal trunk arises from the posterior genu and supplies the pituitary gland, tentorium, and dura overlying the clivus. The infralateral trunk arises from the lateral aspect of the cavernous ICA and supplies the cranial nerves in the lateral aspect of the cavernous sinus and dura of the cavernous sinus. The infralateral trunk gives rise to branches that anastomoses with the branches from the external carotid artery. These anastomotic branches form main collateral supply in the event of occlusion of the internal carotid artery.